My name is Keir Williams. I work at London InterCommunity Health Centre and the Options Clinic, which is the anonymous HIV testing clinic. Everybody is eligible to get a standard blood draw at the Options Clinic at London InterCommunity Health Centre. The funder has also identified 6 priority populations who are able to get the rapid test, which means that you can get your results back in 2 minutes. Those priority populations are gay, bisexual, and other men who have sex with men, people who use drugs through injection, people who identify as being African, Black, or Caribbean, Indigenous communities in London, so that's Inuit, Métis, and First Nations people, and then women who have high-risk sex with men that are in those groups, and also people that identify as being transgendered. So a testing session at the Options Clinic always begins with pre-test counseling to help us get an idea of what risk factors you might have, what questions you might have. If you're engaging in some sexual practices, maybe we can help you to do that safer. And then we will do the test, so either that's the rapid test or we'll do the blood draw. And then if it's the rapid test, we'll give you your results right away, and then we'll do post-test counseling. If we were to do the standard blood draw, we'd wait until we get the results back, usually 3 or 4 business days, sometimes a little bit longer, and then we will do post-test counseling at that point. And post-test counseling includes just talking about what the result means, how often you should come back and get tested, and then again, if you have any questions that have come up, we'll be able to answer those for you. So we begin by disinfecting the finger, and then we give it a minute to dry off. So then we give, so this is a single-use needle. It's a little prick. We find on the side is a little bit less painful than the tip of the finger. Now it's about 2 drops of blood that we need. So then we mix the blood that we've taken in with the red tube here. Throw that away, it's biohazardous. And now we give this a little shake. Normally this would happen in a separate room, but for the purposes of the video, we'll do it here. So we pour it into, this we call the test cassette. We pour it in. Just turn it so you can see a little bit better. And then next we pour the bottle with the number 2 in it. So this is the color developer. So pour it in. And then third, we put in the clarifying solution. Then we make sure that we wait until all of the liquid has gone through. All right, so that dot you see at the top means that everything worked properly. And then if there was a second dot below it, like a button, then that would mean that we had found HIV antibodies. So just that single dot that we see here is exactly what we wanted. This means that the HIV test came back negative for HIV-1 and HIV-2 antibodies. Again, if it had come back with those 2 dots, this would mean that we would then take standard blood draw to confirm the test result. This is only a preliminary test. It's about a 3 in 1,000 chance if it comes back with those 2 dots that it was a false positive. So we would take that blood, we take your blood, send it off to the lab to confirm. And then at that point, we would help make a referral so that you would be able to access care and services to be able to get that HIV treated effectively and quickly so that you would reduce your chance of passing it on to a partner and then also to keep you nice and healthy. In London, now we have an outbreak of HIV. So this makes it especially important for people to make sure you're coming in to get tested. Being on treatment is one of the best ways of helping to prevent the spread of HIV to people that you either share drugs with or people that you're having sex with. So it's really important that everyone's getting tested and so that we can get you on that treatment and make sure that we're helping you to take care of your health and then you can help to take care of your partner's health. Getting tested regularly is very important. HIV is such a treatable condition these days. There's a number of different medications that you can take that really help to protect your health. So the key is to make sure that you're getting tested regularly so that we're able to get that. If you were to test positive, we can find that out very early and get you hooked up with care so that you'll have less of an impact on your health. HIV now, if you were 20 years old, diagnosed with HIV today, we expect you to live to be 73. So that's almost a normal life expectancy. The key is just to make sure you're getting tested regularly, getting on treatment, and following your doctor's orders.